and we really appreciate your patience. So I will provide my welcome remarks in a few minutes, but I first want to welcome the president of the University of Maryland, Baltimore, Dr. Bruce Jarrell, to the stage. Dr. Jarrell, welcome, and thanks for joining us this morning.
Thank you, Dr. Guzman, and welcome to everyone. I know many of you are on different time frames, and so it's a pleasure to welcome you here, whether it's morning, afternoon, or evening. My name is Bruce Jarrell. I'm a physician and a surgeon in the past and now serve as president of the University of Maryland, Baltimore. It is my great privilege to welcome you here to our second Global Health Summit. Some of you may recall we had our first summit here at UMB in May of 2019. It was heavily attended. I had the great pleasure of sitting with many of you, believe it or not, face to face in a room back then. There were people from Baltimore, people from all over Africa and other parts of the world, all UMB associated programs. I made many good friends during that summit. I hope you did too, and I've kept in touch with a number of you. But I think, as you all know, today we're virtual, but I certainly hope that being virtual doesn't dispel the opportunity to have active dialogue as well as to make new friends. From the point of view of this summit, there are 265 participants from 25 countries, many time zones and geography, but I'm pleased to think of us all as one UMB family, and I welcome you. All of us have a common thread of being committed to working to advance health, well-being, and justice on a global scale. Global health and the threats that have been to it over the past year have certainly taken on new meaning to me, but at the same time, it has highlighted how we're all interconnected. One just has to watch the news every evening to know just how interconnected we are. And although this global threat has meant that we could not meet in person, I'm personally aware of the many activities that have still been taking place at our many locations, some of which are represented here. And it's not prevented us from serving UMB's core purpose, which is to improve the human condition and to serve the public good around the world as well as in Baltimore. So we have been doing that, and I want to thank you all for being here. Our first Global Health Summit focused on UMB's global health research. It demonstrated to me just how effective our teams have been throughout the world. Today is our second Global Summit, and we plan on focusing on a different topic this time, global health education. We have some experience with global health education, and I'm happy to say we've expanded it over the years. But we meet today to learn more about this topic. And I want to start by saying I come to listen. I come to listen to all voices, but especially those of our students, because I want to learn how we as a university can be more effective and more comprehensive in our approach to global health education. I have to be honest with you, when we initially started planning this summit, I thought I had a good understanding of this topic. But as I looked into it and listened to my colleagues and learned more about it, I certainly found out that I needed to broaden my view of global health education. And I have done some of that. And for example, I've certainly learned that global health and how it is taught usually reinforces Western medical ideas and practice, what I grew up in, of course, and frequently overlooks other forms of practice and knowledge used in other countries and cultures. And I might say practices at work. So I am hopeful that we can learn from these practices, apply them to our UMB programs, and make them even more impactful. So that to me is a fundamental objective of this summit. It's to hear about these practices, to hear the voices of future professionals and educators from Baltimore as well as around the world, to hear your opinions, their opinions, to hear their ideas that we can take action on and integrate into their programs. These ideas should stimulate us to re-examine some of our assumptions and practices underpinning global health education. So I hope this will lead to a new shared vision that will help guide UMB's global health work, and I look forward to that vision. One last thing, I am really very proud of the role that UMB has played in facing and fighting the pandemic. Our impact would not have been possible without good science and great teamwork and a global attitude toward the problem. Many partners worldwide, I don't need to underscore them. Most of you are representing them here on the webinar. When I think about UMB's role in fighting COVID-19, HIV, malaria, and many other infectious diseases, I can't but think of what are the centers at UMB that cause this impact? What are the programs, the institute, particularly in the School of Medicine, but linked throughout UMB? And there's a couple I just want to give a shout out to because, of course, they're spectacular programs. The first is the Institute for Human Virology. This has led the fight against HIV/AIDS for many decades and other chronic diseases. They have continued to be an international leader. The second one that comes to mind is our Center for Vaccine Development and Global Health. This program, founded over 40 years ago, has changed the very landscape of vaccinology. The work of CVD, particularly on COVID-19, has given us hope that we can survive this pandemic and also prepare for the next. Back September 11th of 2020, so 9 months ago, I was one of the first people to receive the Moderna vaccine in one of the CVD's clinical trials. At the time, I didn't know what I was getting, but that's what I got. And it was a great honor for me to be part of that trial. A third center that comes to mind is the Center for International Health, Education, and Biosecurity, CIHEB, or CIHEB, situated in the Institute for Human Virology. Although originally focused on HIV, it has become extremely involved in COVID-19 as well in many countries on the African continent. I thank them for that. And lastly, the sponsor of this, organizer of this summit, the Center for Global Engagement. This is a center that's educationally funded and based. It has sponsored hundreds of students and dozens of faculty to go and be involved in critical projects worldwide over the last half dozen years. And this center will be launching this month an international operations initiative that will bring together further infrastructure to support and facilitate many of UMB's international operations. You'll hear more about this later in the summit. The last comment to make relates to a process that UMB went through in the last several years. It was designed by the American Council of Education, ACE, and it's called the internationalization process. This was a several-year self-study process to help us understand all of the global activities at UMB, and my golly, were there many of these. And so as a result of that study, a number of strategic initiatives have been developed, which we are now in the process of implementing to make our global view even stronger. And among those initiatives, you already heard from a newly hired UMB global health professor, Dr. Guzman, who was leading this amazing summit. So I think you can conclude we have deep roots in global health and education. And if we work together as a team, we will continue to be even more impactful. And that excites me. So I want to celebrate our success today and the next several days, but get down to work and define the future of global health. I want to give one other shout out to the leadership of the Center for Global Engagement, Professor Virginia Rowthorn, Bonnie Bissonette, Monica, many of you who put together so much effort into making this happen. I know it's a lot of work. Thank you for your hard work and dedication. I am sure that you will have an impact on global health. So thank you for that. I also want to just thank you, although I can't see you. I know we have many old friends that I got to know in Africa. I want to welcome you here and look forward to seeing you. So with that, I would now like to welcome Dr. Robert Gallo. Dr. Gallo is the co-founder and director of the Institute for Human Virology at the University of Maryland School of Medicine. Dr. Gallo is an internationally recognized scientist and leader in virology. His vision has made the Institute become such an international force and to have an impact perhaps beyond his original vision of impacting so many people in need of care around the world. So I'm so pleased, Dr. Gallo, that you're joining us here for this summit and look forward to your comments. Dr. Gallo.
Thank you very much, President Jarrell. It's both my pleasure and my honor to be invited to speak here with you and after you. And I thank you for your kind introduction. I want to just say that the President Jarrell obviously had many things to say, could have used much more time. I'm really here only as to emphasize our commitment to UMB's global health program, our involvement in it for virus infectious diseases. This is the hub on the campus at UMB, though I want to make clear there are other outstanding virologists that are not part of our Institute of Human Virology that are on the campus. And I wanted to say a bit of how this actually happened. I think it's clear from the first two speakers, President Jarrell and me. You heard his background from surgery to leadership at the UMB campus, and in addition to leadership in UMB campus, an entry into global health. It clearly, when he was born, it wasn't destined that that would be exactly the case. And even more emphatically, the same is true for me. There are many doors, I think, to come into public health and public health programs, many pathways. And my career was started at the National Cancer Institute at NIH. I was there for 30 years. And really, even though an MD, I really focused on experimental laboratory. I don't want to really say basic research. It was always kind of translational, but it was laboratory-based research, not in a clinic anymore after my first year. And I really never, ever expected to be involved in global health in any particular way. And in 1980, we had discovered what's known as the first human retrovirus. It's the only known virus that causes leukemia and is actually much more prevalent in some areas of the world far from the shores of the United States. And that includes parts of Africa, the closest where we have significant infection in the Caribbean islands, and that's where we had our first collaborations, but also in many countries, as I said, far away. No time to get into all of that. But this kind of, or actually did, bring us into epidemiology, public health by necessity. That was the beginning. Then came HIV. So we were, of course, deeply involved in HIV from the first. And that really made major collaborations. And it really was greatly stimulated. Things happen sometimes by chance, sometimes maybe that's almost a destiny. But Dr. Alashli Abimiku joined me at the National Cancer Institute as a postdoctoral fellow. She was the first one I had from Africa ever. And it was clear in a relatively short period of time that her heart was in research that would help her homeland. And so I had a collaborator at the National Cancer Institute by the name of Dr. William Blattner, and that initiated a collaboration. We left to come to UMB campus. That was in 1996, and Alashli came with us and was the first postdoctoral I ever knew that went back and forth to her home country. She didn't brain drain and stay in America, but nor did she leave. She connected us. So that began an intense collaboration with Nigeria, really focused in Nigeria, no question. And then came President W. Bush's PEPFAR program, President's Emergency Program for AIDS Relief, that Dr. Blattner, as head of epidemiology in our division, so when we formed the division, we made it into clinic, basic science, and epidemiology. Those were the heart of it, and then animal models. And that evolved in time with greater emphasis on one or another. Dr. Blattner retired, and fortunately, we had in the wings Dr. Mancharirat, who took that divisional position. That evolved further into his not only having an IHV position, but heading a center that President Jarrell mentioned called CHIB, as we were just now very deeply involved in African collaborations. So I know where my strengths are, and they were more in conceptual laboratory science. And that's what I kind of emphasized. But little by little, you're drawn into more and more real collaborations with people abroad, not just in Africa, but heavily in Africa, mainly because of this PEPFAR program. Now today, there are we are a total of 8 centers in Africa. And the two new grants in Mozambique and in Malawi are actually now headed by Dr. Abimiku. She really is a force for us in all our collaborations throughout Africa and an advisor in many special ways. But we form links with, of course, the countries that we are involved with other senior people. And I wanted to also mention that we have a scientist who is public health grounded heavily, but also laboratory research based from Nigeria as a full professor, Dr. Clement Adibamowo, who is also from Nigeria and works in our division of epidemiology and prevention public health relation. I want to really close by saying that we are really committed to the fostering of further collaboration, true collaboration, research collaboration, education, but also lab collaboration, as well as clinical care with our African colleagues, who we are really grateful for that collaboration. And frankly, we think that as the future unfolds, this will be more and more intensive. And we are really proud and happy to have the major interest of President Jarrell and Chancellor Perman in this global health program in relationship to our institute. Thank you for these moments, and if I'm available if there are any comments or questions as we go along.
Thanks, Dr. Gallo and Dr. Jarrell. It's great to hear your words, and I'm flattered to be part of this and be sharing a screen right now with you and all of your experiences, what your work has meant to global health. So thank you for your kind words. I'm going to move